It's just on 3 o'clock. A very good afternoon to you. Welcome to our second live event for the Cardinal Medical Practice Engagement event. My name is Simon Morgan. I'm Head of Communications for the 3 CCGs across Suffolk and North East Essex. You're very welcome this afternoon. We're going to go through the plans that the practice group have got to amalgamate 3 practices in the Northwest Ipswich area. Those practices are Deben Road, Norwich Road and Chesterfield Drive. We're going to hear from each of the clinical leads and also the architect as well, who will share the plans, make the case for change to you a little bit later too. And there'll also be an opportunity for some questions as well. Let's go on to the next slide, please. Just going through the running order and the agenda for this afternoon. Very shortly, I'm going to introduce the panel to you. As I mentioned, this event will be recorded and it will be uploaded onto the Cardinal Medical Practice's website as well. This is the second event, as I mentioned, that we've done. The previous one was held last week too. We're going to go through the case for change, the proposed change. I'll also outline some of the previous engagement that we've done. You'll have an architect's update from Stuart Edgar very shortly, and there'll be questions at the end, an opportunity for you to ask questions to our panel. And to do that, we'd invite you to type your questions into the chat if you don't mind. Our panel will be speaking and answering your questions in a polite and courteous way. We'd ask that you post your questions in the same vein, please. So without further ado, let's introduce the panel to you this afternoon, starting off with James, please. James.
Thank you, Simon. Good afternoon, everyone. My name is James Cookiar. I'm the Managing Director for Suffolk Primary Care.
Thank you, James. Dr. Donapudi.
Good afternoon. I'm Dr. Donapudi. I'm a GP at Cardinal Medical Practice and partner at Suffolk Primary Care.
Thank you. Eunice.
Hello, good afternoon. I'm Dr. Eunice Ifeano. I'm a partner at Cardinal Medical Practice and also a partner in Suffolk Primary Care.
Thanks, Eunice. Andrew.
Good afternoon. I'm Andrew Preston, General Manager at Cardinal Medical Practice.
Thank you, Andrew. And Stuart, who is on mute.
That's a good start. Good afternoon, everyone. My name is Stuart Edgar, Associate Director of KLH Architects and Project Architect on this work as well.
Thank you, Stuart. Now, let's start with James first of all. He's going to make the case for change to you. So, James, over to you.
Thank you. Go to the next slide, please. Thank you. So the background of this is Cardinal Medical Practice was formed back in July 21 through the merger of Deben Road, Chesterfield Drive and Norwich Road practices. And the plan and the aim is to move the practice into one purpose-built primary care location, which is the formerly Tooks Bakery building on the old Norwich Road. It's about a mile from the current practice locations. The Pro site has been selected because of its modern space and ease of access for patients and the local community. The Norwich Road site will remain open and in operation. It will mainly for administrative purposes and some clinical triage services. Why the new building? It's been designed to accommodate the expected growth in patient population over the next coming years. Obviously, it's a modern purpose-built building. The current premises that the practices operate off with the 3 sites don't have any scope for expansion. Some of the clinical rooms and admin rooms are in need of repair or upgrade, and it's not currently in a place to be able to do that. And the opportunity will be to expand the teaching and training that the practice can offer by obviously having some more modern facilities. Next slide. So the new site is formerly used as a Tooks Bakery site. It's, as I stated, will cater for any new residents who move into the area. Any future housing developments that are being predicted in the local area. It will allow the team to develop the range of health and care services that we provide. As I mentioned, increased opportunities for staff training. Obviously, it will be a modern building, so the idea is to help in terms of recruitment with the clinical workforce. It will solve the current issue that all the 3 sites currently have in terms of car parking. It's a major issue particularly for Norwich Road and Chesterford Drive practices, where the use of on-street parking is commonplace. So there's an increasing number of patient car parking spaces, and the links to the proposed building are very, very good, and good bus routes are expected. Thank you.
Thank you very much indeed, James. And the link just about held out there, which is always a good sign, isn't it? So, James, we'll be back a bit later to take any questions that you may have. I'm just going to outline some of the ways that we've been promoting this engagement over the past few months. So the engagement went live around about the middle part of March. We did have throughout the engagement period a survey where we've been finding out people's responses to the proposed plans to amalgamate and consolidate services at those three premises. We've been issuing press releases. We've also shared a lot of social media content, signposting members of the public to the website, the Cardinal Medical Practice website, plus also we've had some website pages that went live on the Cardinal Medical Practices Group's website. Some of that material on there was translated into other languages, most commonly spoken in the Northwest Ipswich area, and also we've had easy read documentation as well, which we've uploaded onto that site too. We're very grateful to our partners in the local media, East Anglian Daily Times, Evening Star in particular. Thank you to journalists there who've helped us to promote the plans, the engagement events, and we have taken out adverts in the Argent newspaper group, particularly in the Evening Star. So there have been adverts over the past couple of weeks promoting these events. So they've proven to be very helpful. Thanks also to our colleagues and our friends at Healthwatch. They've been supporting the engagement throughout with site visits to each of the three practices. They've actually facilitated some discussions with members of the public, patients as well at those practices. So we're grateful for their support too. We have uploaded posters in the practice area as well for any members of the public who perhaps are waiting to be seen. Again, highlighting, raising awareness of this engagement activity. I've mentioned the easy read, mentioned the translated information on the website. And in addition, we've produced briefing material for our councillors as well, and also members of the Health and Overview Scrutiny Committee who've been in turn raising awareness within their local communities. So again, grateful for their support too. So that's how we've been promoting the engagement. The engagement runs for another week, so it finishes next Tuesday. And we would encourage anybody who's got a view or would like to express their opinion about what you're hearing this afternoon, please do get in touch, fill out the survey, and have your say. Closing date, as I say, is next Tuesday, the 24th. And with that, I'm going to pass over to Stuart Edgar. Stuart.
Thank you, Simon. Okay, so I'm going to run through the presentations as they stand. We haven't quite got a planning application submitted yet. We have been doing public consultation events of our own as well, which I'll go through these boards. As mentioned previously, the site is the former Tooks Bakery site in Ipswich. The north of this area was previously developed. We were the architect on the residential development there as well. That was completed in 2020 with planning permission achieved in 2018. And when we were doing the event for consultations for those, and when we were submitting for planning for it, it was understood that the south portion of the site that we're now talking about was going to be outlined for healthcare use. So the north of the site here is already now developed for residential use. The south of the site is the proposed healthcare site. And this is adjacent to Bury Road and Old Norwich Road. We have most of our information back from third-party consultants now, and we're looking to put a planning application in probably the next 2 or 3 weeks. Generally, ecology and arboricultural, so it's trees, we have no major issues with, no major standings. Arboricultural-wise, the site has TPO trees flanking the south and the east side. That's the road sides on both elevations. And we're not looking to take out a vast number of trees, but there are some lower trees, surgeries done, and possibly some minor removals just to allow access from the south of the site. This is our proposed block plan. So Bury Road on the south, Old Norwich Road on the east. The access into the site via vehicle access is from the north through the existing housing estate, which I just mentioned. That brings you into a secure compound, and we have separate staff car parking to the rear entrance to the building, and then public parking to the front. We also have disabled bays and cycle spaces. The site's fairly well accommodated already in terms of bus routes, and that's something that hopefully, depending on other local developments, we'll see some further advancements and additions to the bus services in this area. We would be having two entrances. So the one on the north, serviced by the car park, is in this corner, in the corner of the building. Externally from the site, we have crossing roads on Norwich Road further up here, and we'd be having a footpath and cycle path access directly from the road there. The floor plans, ground floor we're looking at here. So both the north and south entrances bring you into a shared lobby where you'll be greeted by initial receptionists. There is some clinical space on the ground floor and further clinical space on the first floor, with our main waiting on the first floor as well, and stairs taking up to that space, and also lift access. Ground floor also features a third-party operated pharmacy. This will be open directly out onto the forecourt and the car parking area, so you don't have to come through the lobby to get into that space. There is a staff training suite, and this is the staff entrance, and we have showers and changing facilities, plant rooms. We have a staff breakout area, and then we have some free rooms. So these are much more flexible in terms of use. So we have partitions that can be folded back internally. So you can have one large space, or you can have several smaller spaces. They also open directly onto the car parking forecourt and pedestrian area, so they can be independently used. So if we were having, for instance, in the last few years, vaccination processes happening here, you wouldn't necessarily have to come through the main building to get to these areas. You'd be able to come into one entrance through the building, having your inoculations or your vaccinations en route, and then back out again. So it becomes much more flexible for use. They can also be used for staff training. They can be used for group council sessions, etc. They have their own WCs. They have a small breakout area and a small kitchenette as well to service those areas. The north wing, this is our ground floor accommodation in terms of the clinical spaces. Overall, we have 29 clinical rooms and 11 nurses' rooms throughout the whole building. We have a subway in the centre, and then surrounding there is our nurses' rooms and our consultant rooms and the associated clinical cleaning, dirty utility, clean utility spaces that you would need for those areas, as well as WCs as well. Take you up to the first floor. So it's very similar arrangement on this wing, and then generally repeated on the left-hand wing as well. So we have three wings, three separate areas here, although it would be one general practice providing all of the care services. Again, each one has its own smaller subway, and then the larger waiting area happening in this zone where the two elements of the building overlap. We have a reception at the top of the stairs. Again, this is where our lifts will be coming up. And the view from the waiting area will face down the road onto Old Norwich Road to south of Ipswich. As a modern building, we are able to have much improved standards in terms of space and space standards from the existing units. So the three practices at the moment would have been built to previous standards. We are now fully HTM and HBN compliant. Also, in terms of modern building regulations, much more thermally efficient, better rights to light, things like that. So built to modern standards and everything that entails. This is as we see the building shaping up externally. The materials palette takes its lead from the residential development already completed to the north. So we have two different colours of brick. We have one element that is two-storey buff brick, and that's the wing that flanks Bury Road. And then the other wing is a darker sort of blue-grey engineering brick on the ground floor, and a vertical standing seam metal cladding in a grey colour on the first floor. There is a projecting element to the first floor element here, which is where our waiting room is on first floor. That gives us a canopy over our entrance for the pedestrian route and for the bus stop route as well on the ground floor. In our car parking space, this is our sort of forecourted area as mentioned. windows at the back here and doors, giving direct access onto the pharmacy space, and then out of shot to the right here, but again serviced from this forecourt area is where we'd have those flexible use spaces. So a couple of external renders from higher level here. This one from Berry Road, this one again showing our car park spaces and showing how these two masses combine, and some small material swatches here just showing what we would propose. External hard standing tarmac for the parking arrangement, and probably some hard standing in terms of paving slabs immediately to the building. As part of our planning permission, we have had a separate public consultation event as well, which is where these boards have previously been presented, and some of you may have met me on those events. That was a Witten Health Clinic on the last week of March. And we had two events, one in the daytime, one in the evening, hopefully to cover more footfall. And I think that probably is all I have to say at the moment. I'm looking forward to any questions that we can help with later on. Thank you.
Thanks very much indeed, Stuart. Well, we've got one question already, which is great. Please do post your questions in the chat, and we'll put those to the panel. So thank you for whoever has posted that question. We'll come to that in just a second. I'd like to bring our clinical colleagues in now, if that's okay, and Dr. Donna Pudi, if I may. Could you perhaps answer the question about how will the new facility, if it does go ahead, support with the with accessing services, and also I understand that training is a big part of this new proposed build as well. Just perhaps elaborate a little bit on that, if you may. Thank you.
Certainly. I think, like James said, the existing buildings are not fit for purpose anymore. We've outgrown all of these buildings and there's no scope for further improvement. And hopefully the new build will give us that opportunity that we'll be able to occupy, and also more importantly, unify and expand the team, increase use of multi-skilled workforce, being able to service the needs of the population better. Training, like you say, Simon, is an important part in the sustainability of this one. So we are currently training Cambridge and University of East Anglia medical students. We haven't been able to take all the cohorts of students, and also the GP trainees. We haven't been able to take as many trainees because of the lack of rooms and the ability to supervise while you are spread thin on 3 different sites. This would give us one site where we can concentrate all the resources and help serve the patients and also improve our training facilities.
Lovely, thank you very much indeed. Perhaps one of the other things that did get mentioned on the previous live event that we ran last week was around public transport, and 1 or 2 questions around that. I wonder whether Stuart might be able to address the issue about public transport bus services to and from the area. Please, Stuart.
Thanks, Simon. So as part of our BRIAM application as well, which is part of our planning, we have a transport statement that's currently underway. That will be part of the planning permission. We haven't received it as yet, but in discussion so far, and certainly as part of our consultation event in March, there was immediate feedback in the press from Ipswich Buses that they would hope that by the time the building is fulfilled here and achieved, there will already be improvements made. So it's outside of our scope in terms of making that happen. Our Ipswich Borough Council client also sees this as something that we would like to have improvements on. And once we have the formal planning application, our transport statement is assessed locally, but also with Suffolk County Council in terms of highways and Highways England. And between those authorities, that's where we'd be looking for some further improvements to the site outside of our immediate control here. We do already have bus stops close enough to the site that will certainly service the building. But as this north area of Ipswich continues to grow, it's something that Ipswich Buses are already looking at in terms of improving. Might also be worth pointing out at this point that as part of our planning application as well, we have to include 20% electric vehicle, EV charging as well. And the roof of the building will be covered in photovoltaic PV panels. So there will be on-site solar harvesting for electricity. And we'll be able to offer possibly to staff, possibly to public as well, some charging points. So it's looking towards a green building.
Thank you, Stuart. I was going to come on to all things green very shortly, actually. So if I may come back to you with a question about the impact on the local environment in just a second. I'm going to go to the question which one of our attendees very kindly has put into the chat. And just another reminder, please do post any question you may have in the chat. If we don't get any questions, we will bring this to a close early. So thank you for the question. It is as follows. If you do not speak English, you will not find the translated information on an English-speaking website. Even the words if you speak Lithuanian is not Lithuanian. So I doubt anyone will make any request for the info in their own language, which is all the document says. Well, thank you for the question. You're absolutely right. It's so important that information is available in a range of different languages, and you'll be aware that on our website we do have information that's been translated into Romanian, Polish, Lithuanian and Kurdish as well, basically that says that if you require this document or information in your language, please make contact with us and we will make sure that that has been translated or available to you in a different format that is suitable for your needs. So we've made that offer in those various languages, which we know are the most commonly spoken languages in that part of Ipswich. But thank you very much indeed for the question, and a very important question at that. Again, just another reminder, please put your questions in the chat. We'll get around to asking your question if you want to post one now. If not, we will bring this session to a close early. Back to Stuart, if I may then. So just following on from the question about or the answer rather you gave about the local environment. So what consideration has been made about the local environment, and you mentioned there a bit about the building materials. Are there any other considerations that have been taken into account concerning that?
Thank you, Simon. Yes, so at the moment the site offers very little in terms of environmental and biodiversity. It's part of the old Tooks development site. The building was removed, but the slab, the floors, the foundations part still remain, and there's a lot of hard standing on this site. So at the moment, the trees we have on the south of the site and the east flanking both of the roads here, they're TPO, so they're protected trees. Everything else that we're showing in the core of the site here in terms of green space is what we're adding. So a lot of this site is not even brownfield site. I mean, it's complete hard standing. There are no trees in the core of the site. We'd be able to add some of those in pockets of landscaping, adding to our biodiversity. And we can also add, and we would as part of our planning permission as well, be looking to add in bat boxes, potentially bat and bird boxes. And we have to make improvements, and actually this site offers a lot of potential for improvements because it's in such a poor state, biodiversity and ecologically as it currently stands. The building itself, being built to current building regs standards, will be much improved on the existing 3 practice buildings. Now I know one of those is still to be used as admin, but in terms of patient use space, people will know that they're generally well heated. Air conditioning is in here as well, but by having a much more thermally efficient building, we're not losing as much heat, as said with the PVs on the roof, which we're showing here indicatively. We'll be able to generate some of that energy on site as well. Modern thermal insulation, modern building standards will mean it's a much less leaky building as well, heat wise.
Lovely, thank you, Stuart. We've got 2 more questions that have come in whilst you were speaking there. One from Lucy Trenchard. So Lucy asks, will there be secure bicycle parking facilities on site? That might be another question for you, Stuart.
Yeah, I'll keep this plan up as well. So there will be. At the moment, we're showing 2 cycle spaces, 2 cycle areas rather, a separate for staff, which is closer to their changing rooms and the staff entrance, but we do also have a publicly accessible cycle store. Now the security for access on site, this dash dot line running through the middle of the car park here would be a nighttime security gate and fence just to reduce the car park. So it's anticipated that we could have some potential out of hours use here, potentially sort of triage areas, or it may be that the pharmacy is able to operate slightly later hours than the GP's practice itself. So we remain the cycle storage some parking spaces and some disabled spaces will remain slightly later, but it is still envisaged that the main entrance to the site will be locked off for nighttime use, so it doesn't become a problem area.
Thank you, Stuart. One other question from Kerry at Healthwatch. She says patients that have limited mobility have said the current bus stops are too far away for them. Meredith Road is uphill and the B&M bus stop does not have a safe walkway through, so there needs to be joint responsibility. I think it's more of a comment than a question, but Stuart, is that something that could be noted, please?
Yeah, so again, once the application is put in, it will include a transport statement, and it might be that transport statement, as we're still yet to receive it will probably pick those features up as well. So it's an excellent question. It's not something that's slipped us at the moment. So bus services to the site could be improved, but we need to look to the council to have support for that, and it actually gets put into their remit. But once we put the planning application in with our transport statement that will highlight those potential improvements, that's when Suffolk County Council and Highways England are able to pick those up and act upon them. And I think that's where preemptively Ipswich buses were commenting earlier this year in March, around the time we did our previous public consultation, that this is the sort of improvements they would look to make for when the building is delivered. So they're certainly aware of it now. Once the planning application goes in, they will be reviewing further, and hopefully that's when we can see some changes being made.
Okay, thank you very much. Question here from Councillor Shaw. Could you say more about the proposed pedestrian access at the junction of Bury and Old Norwich Road? Will this road junction be something or other? I think she hit send a bit too early there. So radically improved. Right, there we go.
Yes.
Okay.
It certainly needs improvement. So at the moment we have the bus lane on the north of Bury Road and cycle lane combined as well there. Now, when we did the 2018 exercise of going through this with the North residential site, as I said before, it was already known that this was highlighted for medical use, GP use, and at that stage there were potential improvements penned in that we could have a separate cycle lane put along Norwich Road here, north of Bury Road here. Now, I don't know if that's still the case. We'll be looking for that in the transport statement when we receive that in the next coming weeks. But certainly there are improvements to be made on the corner. The traffic lights itself could be improved, and we would hope that there's a better crossing available in the future as part of the delivery of the building. But at the moment, there is no footpath that continues around the corner. So that's something we'll be looking to add in, and that's where we'd need some minor tree removals or possibly just some lower shrub removals happening on this corner to facilitate a new footpath coming in.
Okay, thank you. One last question here then. Will there be baby parking spaces for those who use car seats?
At the moment, that's not something that has probably been that detailed, designed to that level of detail yet. We know that we have to deliver a certain number of EV spaces and disabled bay spaces. Child and family parking spaces are at the discretion of the users. They're not something that's legislated in terms of delivering numbers. That's not to say we're not going to put them here, but certainly when we get our transport statement back, we may be looking for some advice there from our third-party consultant to say, how many do you think we need here? At the moment, the layouts that we're showing is what we know we have to achieve. This is prior to us having feedback from our third-party transport consultant. So there will be changes to this. They'll be made prior to the planning application going in, but once that's made in the next sort of 2 to 3 weeks, these will be publicly available to view again.
Super. Okay, well, that brings the session to a close for this afternoon. Thank you very much indeed for joining us. Thank you for your questions. Thank you to the panel as well. The engagement continues until next Tuesday, so if you do have any additional comments or feedback, please do visit the Cardinal Medical Practice website where the link to the survey can be found, and please do take part, give your views, make your views known. Thanks once again. Have a good rest of the afternoon. Bye-bye.